This is your first physiology class. Physiology is very easy. Physiology is very easy, but very essential for doing all the medicines, clinics, etc. is the best. This is very much important classes to do to understand the pathology and also the pharmacology. In the class, outside the class, ex-students or your first year batch came to me. Came to me that said I got honors in the patho and pharma. But he praised me that the first year classes of physiology is helped to understand the pharmacology and the pathology also. So that is a big thing. The understanding of physiology is very easy in MBBS classes, but understanding properly and utilize that in the other subjects is our motto. At least my motto is that. So not only that, you will go for the theoretical, right? আজকে তোদের কি পড়াতে হবে বল, কিছু লেখা আছে? I never know any syllabus of your classes. I know only the blood have to be started first. So anything your chart, এদের কি চার্ট ফাট কিছু দেয়া হয়নি? ডক্টর অয়ন কিছু পাঠায় না? কি রে, এখনো কিছু দেয়া হয়নি? হ্যাঁ, আসে না ইয়েতে মোবাইলে? কি ক্লাস হবে এটা তো দেয়া হয়, ক্লাস ফ্লো বলে দেয়া হয়নি? ওকে, ফাইন, কোনো অসুবিধা নেই। So first of all, before going to proper class, hematology will be started first. I will start hematology. Probably our HOD sir is very gentle and you can say very cool guy. You are lucky that is last few months he is here up to April. After that, new HODs will come. Otherwise, I will take as a HOD. Anyway, so before going to the hematology chapters or other chapters, each and every chapters have some clinical implications. I will start from that. Suppose you're going to be a doctor and you already passed. Suppose already passed the MBBS, not so easy to pass, but you have passed and you were sitting in a OPD and a patient came with having some fever, simple fever. এখন যেটা হচ্ছে দেখি রে, এটা কি চলে না? এটা চক দাও। So coming with fever, right, with cough. This season is very common. So cough and fever for like 7 days, right, came to you. Any fever is more than 7 days or 7 days, we have to go for some investigations. It's needed practically. So we order a blood test that is called CBC, complete blood count. That means blood. So that's why you have to understand what is the CBC, and within the CBC what are the tests. Hemoglobin, total count of WBC, RBC. নামগুলো শোনা তো নাকি নিশ্চয়ই 12 পড়ে এসেছিস, হ্যাঁ? WBC means white blood cells, or it is called leukocytes, number of leukocytes, hemoglobin, and the percentages, everything is important. Another patient come, it is number 1 patients. Number 2 patients come with unconscious, কোনো consciousness নেই. Number 1, number 2, convulsion, খিচুনি হচ্ছে. First we do at the OPD, do a CBG means blood sugar level, complete blood sugar level or random sugar. Sugar কমে যায়নি তো? If it is anything, it is less than 60, he will be in unconscious state and convulsion also. Number 1. Number 2. Number 3. Suppose you're coming with loose motions. হয় না? সবারই হয়। Severe loose motion with dehydration. কি দেবো test? Sodium, potassium. I like to highlight that I am not to diagnose the case now at all. I like to highlight that why blood samples is very important, and within the blood what are the components of the bloods, right? আমি যদি কম্পোনেন্টস না জানি তাহলে আমি বলতে পারবো না যে আমি কি টেস্ট লিখবো। এই যে আমি সোডিয়াম পটাশিয়াম লিখলাম, ব্লাড ফর সোডিয়াম পটাশিয়াম কেউ করে না, কি লেখে? সিরাম সোডিয়াম অ্যান্ড পটাশিয়াম। So that is serum. Another term is plasma. So that is plasma, what is serum, why it is come, What are the total counts of RBC, total count of WBC, total count of platelets, functions of platelets, functions of leukocytes, functions of RBC, what are the internal structures of RBC, how can you differentiate between RBC, WBC and platelet, why it is called erythrocytes, all these coming in the physiology and hematology chapters. Step by step I will go for. So components of blood is important. Before we going to the any investigations is must that should be done by these patients. Like 3 types of patients I explained. One patient is coming for cough and cold, another patient is coming for unconscious convulsion. Convulsion means seizure, and third patient is having severe dehydrations due to the loose motions. Anything may come, but these 3 patients mean 3 types of investigations we are doing on. One is CBC, one is CBG, sugar, and also the serum sodium and potassium. And also different, suppose in case of convulsion also, we can see that the calcium, because calcium is important for neuromuscular junctions, functions, etc. It will come day by day, you will achieve some knowledges if I go for it. And then these types of bloods is essential to collect. Ekta blood nite gele take to collect korte hobe. We normally don't want to be hospital. Kono log chaye na je ami hospital jabo. Kintu jokhon se chole gelo tokhon take blood tante hobe. It will draw the blood and then it will kept into a tube. Special tubes are there. Presence of anticoagulants. Why it is important? Date blood jome na jay. এই ব্লাড টানার পদ্ধতি তোকে বলি, একটা হচ্ছে এই ব্লাডটা যে আমরা নেব, if you collect the blood, after some time it will clot. একটা কন্ডিশন বলতো যেখানে ব্লাড নেওয়ার পরে কিছুতেই ক্লট হবে না, এনিওয়ান? স্নেক বাইট, ভেরি গুড, এক্সিলেন্ট. Recently, 6 months back, a patient come to me with diarrhea, abdominal pain and vomiting. Simple. I thought this is a viral AGE, acute diarrheal infections or gastroenteritis. But after giving the prescriptions, I am seeing that the patient is chokta erokom korche, mane dhule dhule porche. So I thought the electrolytes may be the problem. I write also the serum sodium and potassium is essential for his loose motions. The sodium hyponatremia deal with or the hypokalemia dealing with. But still I am seeing the patient his eyebrow is always this line. মানে চোখটা ওকে ফেলতে গেলে চোখের পাতাটা ওর পড়ে যাচ্ছে. That means he is suffering from ptosis. So I suspect that may be some snake bite case, but the patient party refused and argued me, স্যার কিছু জানেন না, কি হয়েছে, ডায়রিয়া হয়েছে, কোথা থেকে সাপে কামড়াবে, আমি জানি না, সাপে এটা কামড়াতেই পারে না, কিছু না. আমি তখন প্রেসক্রিপশনে লিখি যে do a blood test immediately at nearby, that is there is a corporate hospital, there is health ward hospital, but they refused. They go to the Bakura and then 8 p.m. some hospital authority or emergency medical officer called me, because I have given the timing, etc. This is a legal part. And the patients came with convulsion, with some frothing in the mouth. So that was a snake bite. And this blood was not clotted at all. And then treated, and the baby child is safe. The patient was nearby 9 years old. So normally it was a colored snake. It is a no snake bite, no mark at all. So the patient's party also does not know at all. But the presentation is like acute gastroenteritis. So again see blood. So blood is essential to detect one diagnosis, that is that maybe the snake bite, if does not called, if it is hemotoxic, but it is a neurotoxic, it may clot. If it is myotoxic, that may clot. It's only for the hemotoxic. Collage is a hemotoxic, and if it is persist for more than 24 hours, the kid will die. Definitely 100% will die with the kidney failure, etc. So these things are important to know, understand the blood, and blood, within the blood some components are there. How you can differentiate the components of the blood? Because after taking the tube, suppose a test tube is taken and blood into this, blood is there. After that, it is kept, after taking many patients, like 5 to 7 patients blood taken sample in the lab, and then it is centrifuged. centrifugal force is required to spin. The spinning machine is there, probably in your department is there. So spin is essential for centrifugal force applying to separate the blood components. So that is called key centrifugation. Centrifugation. After the centrifugations, you can get the components of the blood. Anybody you can say what are the components of blood? Bolo. Plasma. Good. Then blood cells. Blood corpus cells. Best. Then many terms we know in the 11, 12, you have to come forward. That's we are telling the blood corpuscles nowadays is called form elements. What is called? That is called form elements. FORMED elements. Means blood cells are there. It is a component. One other component is plasma. Right? It's better to tell blood plasma. Okay? And then another is the buffy coat. So after the centrifugations, it will see that 55% are plasma, less than 1% is called buffy coat, presence and coming, and rest is dense. Because during the spinning of the machine by centrifuge machine, this causing the dense material or dense substance like form elements is deposited under the tube. Right? So these are your RBC. And less than 1% cases is buffy coat. It is called buffy coat. It is present as platelets as well as WBC. And here it is a plasma. Right? In the blood, what are the main compositions of our blood is water. Right? Water. So 55% of plasma and 45% of RBC. Nowadays, you know, in case of dengue fever, always doctor prescribe one term that is called hematocrit or pack cell volume. This is very, very important marker to detect whether patient is suffering from any capillary leakage due to the dengue viruses. Dengue viruses, why hoche okhane? Dengue is a virus, is arbovirus, it is by the Aedes mosquitoes. It's not a fundamental right that is day te kamrai rate bela kamrai na abar rate bela kamrai dine bela kamrai. This is all are vague. All are vague concept. There is no such concept is there. Na ei kamrai na pain niche utte pare na. All are wrong. Absolutely wrong. So dengue virus is going on. Last few weeks we get in the children also. So always we prefer 1 to 2 every alternate day. We do the term. There is a hematocrit. What is the term? Hematocrit. That means what? Hematocrit means what? Hematocrit means RBC percentage within the total number of volume of blood. So that is 45% is a normal value of this hematocrit. Right? If it is less, if its hematocrit is going down, that means leakage already has been started. So be very, very careful. As well as platelet count in dengue is drastically down. 10,000, 20,000. Platelet count normally is 1.5 lakhs to 4 lakhs. So anyway, this hematocrit value means this portion I want to detect. That is also called pack cell volume. Hematocrit pack cell volume is investigations of choice nowadays in each and every day or every alternate day in case of any dengue patients, suspected dengue patients. So in that case, this plasma is no longer required for a dengue patient. But suppose a patient comes with edema. What do you mean by edema? Anyone? Swelling. That may be pitting edema, that may be non-pitting edema. That is a different issue in the clinical part. But whether it is nowadays the two types of spelling is there. It's edema and also edema. Both are same and both are applicable. In the UK, that language is used edema. So whatever it may be, edema is a swelling of any places due to by any such reasons. One of the important reason is that lack of albumin. Lack of albumin or malnutrition, lack of proteins. So these albumins and proteins are present in the plasma. So I am coming to the freshly and clearly in the plasma. So what is a plasma? You know already after the centrifugations, 55% of these are the plasma, and within the plasma there are normally some components are there. Number one component is water. Yes, this is a 92 or 90 to 92% is water is there. Number two is the proteins. Number two is some proteins are there. I'm coming on to the proteins. Number three, some electrolytes. এই যে একটু আগে বললাম যে সোডিয়াম পটাশিয়াম করতে হবে, তার মানে আমাকে ব্লাড সেন্ট্রিফিউশনস করে আমাকে I collect the plasma, and then from this plasma we have to detect the electrolytes. What are the electrolytes? What are the electrolytes? Sodium, potassium, calcium, magnesium. These are the cations or the anions. Chlorine, bicarbonate, sulfate, phosphate. Okay. Within these cations, which is abundant in our body, important, sodium. In anions, which is abundant, chloride. So sodium chloride is essentials. So electrolytes are present in the plasma. Now hormones also present in the plasma. Number four is the hormones. Hormones also present in our plasma. Number five, gases. Different gases also dissolve in this. That may be oxygen. Oxygen is carried by RBC, but that may be dissolved, and carbon dioxide also. Gases. So water is a main component. 7% is a protein. The rest is electrolytes and also the gases, hormones, etc. And also nutritions. Suppose তোরা একটা কি খেয়ে এসেছিস আজকে? Bread খেয়ে এসেছিস, তাই তো? Bread খেয়ে এসেছিস, কেউ ডিম খেয়ে এসেছিস. So all are there. In the bread there is mostly carbohydrate and into changes into the sugar form, right? If I go through the GI tract, then there are different part. So sugar may be present. Proteins, amino acids is absorbed as an amino acid. Carbohydrates is absorbed as a sugar. The sugar is essential for this our body to the calorie gain. And these are the number 6 is the nutritions, right? So nutritions, electrolytes, gases, hormones, water, proteins are important in the plasma. তাহলে এতগুলো জিনিস আমার যদি আমাকে ডিটেক্ট করতে, if I want to detect any steroid levels, cortisol levels, different diseases are there. I'm not going into details into diseases. Insulin level nowadays is very important. Before going to the diabetes treatment, we have to detect the insulin levels. কোত্থেকে আসবে? প্লাজমা। কিভাবে পাবে? সেন্ট্রিফিউগেশনস, কালেকশনস করব, কালেকশনস করি অ্যাটাচড উইথ অ্যান্টিকোয়াগুলেশনস। তোমরা বাইরে গিয়ে কথা বলো প্লিজ। So this is the factual fact that these things is essentially known. You have to understand the আমি কি টেস্ট লিখব। আমি লিখতে পারবো না যে তুমি শুধু লিখে দাও ব্লাড ফর, লেখে প্রাইভেট পাস আউট, ইভেন গভর্নমেন্ট পাস আউট is written as a blood for sodium potassium. Not at all it is blood for sodium potassium, it is serum sodium and the potassium. Now my next question is come, sir আপনি তো প্লাজমা বলছেন আবার সিরাম বলছেন, what is the difference between this? প্লাজমা কাকে বলে আর সিরাম কাকে বলে? What are the difference? Anyone? Plasma without clotting factors, plasma. Serum is a, you can go, no problem. So this প্লাজমার মধ্যে ক্লটিং ফ্যাক্টরস আছে। তাহলে আমি এই যে প্রোটিন বলেছি এখানে, এই প্রোটিনের মধ্যে আমি যখন আসবো I will say that some clotting factors are there. Clotting factors mean proteins are there for the coagulation and clotting pathways. That is a different issue. But serum without any clotting factors. Remember that final in the professional areas, external may ask you. You can be faced these questions. What do you mean by serum? What is the difference between serum and the plasma? Plasma means with clotting factors, and serum means without clotting factors. So that's why anticoagulate using tube is present, and then centrifugations. তাহলে আগে আমার ব্লাডটাকে লিকুইফাইড করে রাখবো, and then I try to centrifuge by using the spin as well as centrifugal force. The centrifugal force means from center to outward. So কি করবে? Separations of blood components in this way. That is called centrifugation. Then 55% plasma and 45% is key RBC. Buffy code is less than 1%. That presents only the platelets and leukocytes. Very good. So these things are important for plasma. Now I'm coming to the protein first. What are the proteins? Any idea? Already I told you, any patient is having some edema or is suspected in lack of albumin. For the normal level of albumin, serum albumin present is 3.5 to 5.5 is different, book is different. I am telling that the book, is some clinical books, that is a G per gram per DL. It is a normal level of albumin. If anything less, suppose the patient is having some 1.5 albumin, then it will suffer from edema. Why? Can? তাহলে প্রোটিনের মধ্যে আমি প্রথম বললাম কি? অ্যালবুমিন. Alb means white. Min means protein. So anything it is a white type of protein is that. So it is alb word is Latin term is come to the white, and min is a protein. Anything min is a protein. So albumin is also a, two things are there, that it controls, it is a colloid. It is a colloid. What do you mean by colloid? General physiology hoyni, right? Colloid means a substance which does not cross easily through semi-permeable membrane. যে does semi-permeable membrane দিয়ে cross করতে পারবে না যে সমস্ত সাবস্টেন্স তাদেরকে বলা হবে colloid. So albumin is important to reduce the oncotic pressure, ONCO TIC pressure, oncotic pressure, বা আরেকটা নাম আছে এইটার colloidal osmotic pressure. কি হেল্প করছে অ্যালবুমিন? অ্যালবুমিন is helps to reduce the oncotic pressure or colloidal osmotic pressure. কেন? কিভাবে? তাহলে আগে একটা ব্লাড ভেসেল একটা আঁকা যাক। তাহলে ব্লাড ভেসেলস এর মধ্যে আমার আশেপাশে টিস্যু আছে। সাপোজ দিস ইজ এ ব্লাড ভেসেলস, রাইট? ব্লাড ভেসেল তো একা বসে নেই। সো দেয়ার আর সাম tissues are there, right? Cells are there. This space between these vessels and these cells is called interstitium. It is called interstitium. In the blood, এখানে প্রচুর ব্লাড যাচ্ছে। ব্লাডের মধ্যে কি আছে? জল আছে তো? বলে দিচ্ছি তো, প্লাজমার মধ্যে 92% জল। তা যদি তাই থাকে তাহলে আমার এই জলটা এখানেও তো দরকার, এখানেও তো আসবে। কিভাবে আসবে? বাই হাইড্রোস্ট্যাটিক প্রেসার। প্রবলেম ইজ দ্যাট যদি আমার এখানে জল চলে আসে, ইন্টারস্টিসিয়ামে যদি জল চলে আসে, তাহলে দ্যাট মে কজ ইডিমা। ইডিমাতে কি হয়? অ্যাকুমুলেশন অফ ওয়াটার, accumulation of fluid. You can better take the fluid into the interstitium space. It is called edema. And that may be due to the lack of albumin. The albumin er kaj ki? To pull the water, to keep stay at the blood vessel. তাহলে ব্লাড ভেসেল এইটা হচ্ছে হাইড্রোস্ট্যাটিক প্রেসারের জন্য, আর এখান থেকে জল আবার নিয়ে আসা মানে পুলিং ব্যাক by due to this albumin. So that's why albumin prevents edema. So any patients usually suspect the patient is suffering from malnutritions or some sorts of liver disease. কেন বললাম liver disease? Because albumin is synthesized from the liver. So any patients with chronic liver disease may came across the lack of albumin and presented with the edema. It will came whenever you are in second year, third year, you go to the clinics, you can see some edema patients, cirrhosis of liver patients, chronic liver disease patients, all having some edema will be there. Because albumin is synthesized mostly in the liver, but not stored, very few percentage is stored in the liver. It always come into the blood flow. বলে ফেলো। কি বলছি বুঝতে পারলাম না। না না না, একদমই না। অনেক কজ আছে গাদা। আই এম কামিং টু দ্য প্রোটিনস, সো আই এম কাম টু দ্য অ্যালবুমিন। আমি যদি ইডিমা নিয়ে ঢুকি তাহলে লোকে মারতে আসবে। অ্যালবুমিনে ঢুকে গেলে আমি অ্যালবুমিন আমার মানে তোর 1 বছর ধরে শুধু অ্যালবুমিনই যাও করিয়ে। So lots of things are there. I am focusing that why plasma is important for your knowledge. Because plasma have albumins, and albumin acts to reduce the oncotic pressure so that accumulation of fluid in the interstitium is prevented. Simple. If it is less than this level, then the pulling power will be less. Right? Now question is that, স্যার ওই যেটা বললো স্যার শুধু অ্যালবুমিন কি এটার পুলের জন্য দায়ী, এটা কি বলতে চাইছিস? না অ্যালবুমিনের জন্য ইডিমা হয় এটা বলতে চাইছিস? কোনটা বলতে চাইছিস? এই যে ওয়াটারটাকে পুল করছে তার জন্য কি অ্যালবুমিনই শুধু দায়ী না অন্য কেউ আছে, এটা বলতে চাইছিস? কি কি বলতে চাইছিস যে ইডিমাটার জন্য আদার কোনো কজ আছে নাকি? ইডিমা কজ গাদা কজ। ইডিমার কোনো কজের ইয়ে নেই। ইডিমা দ্যাট মে বি রেনাল ফেলিওর, that may be congestive cardiac failure, that may be heart failure, that may be congenital heart disease, that may be anemia, that may be any sepsis, that may be due to any sorts of varicose veins. Lots of causes are there for edema. I am edema due to the lack of albumin, I am telling. It's only a few second parts are there. So if it is less, then that will be countable. But why only the albumin is there? Because albumin is abundant in the plasma. Others protein like globulin, second protein ever asbe, that is called globulin. That is called globulin. Globulin. This is also a protein, also synthesized in the liver, except one. I am coming. So globulin er bhag ache abar. That is alpha 1, that is alpha 2, that is beta, that is gamma, right? So gamma globulin means antibody, that is immunoglobulin. Only all these alpha 1, alpha 2, beta are synthesized from liver except gamma. Why? This gamma immunoglobulin means antibodies, and antibodies comes from plasma cell. It will be learned after few classes. Whenever we are dealing with the stem cell, etc., then you will understand why I am telling this gamma globulin is not in the liver. It is from the plasma cell. কোত্থেকে এলো? B cell. কোত্থেকে এলো? বোন ম্যারো। বোঝা যাচ্ছে? সো বোন ম্যারো থেকে গামা গ্লোবুলিন তৈরি করা যায়। Because gamma globulin is coming from plasma cell. Plasma cellটা আসবে কোত্থেকে? B cell. B cell আসবে কোত্থেকে? Stem cell. Stem cell থাকে কোথায়? বোন ম্যারো। So all the others like albumin and alpha 1, alpha 2, beta globulin is present in the plasma, and synthesis is done in the liver. তাহলে liver cirrhosis, liver problem, acute chronic liver disease, anything due to liver oriented, all of these are affected, right? In case of dengue also, I already told that dengue is hematocrit part is very essential, PCV's part is very essential. In the dengue also, this virus attacks the hepatocyte cells, and these are globulin alpha 1, alpha 2, beta and albumin are synthesized from the hepatocyte cells. So if dengue virus is attacks into the hepatocyte cells, that all be deranged. So that's why some patients may present after 7 days edema. আমি দেখেছি, I have seen many children came with the rashes, fever, with the edema. That does not mean that always the albumin will be less, because if dengue patients is suffering from a dehydration or lack of pulling of in the capillary leakage, কি হয়? সমস্ত ক্যাপিলারি থেকে ব্লাড বেরোতে আরম্ভ করে, that is causing the hypovolemia, right? Now we prescribe that a shock is present, dengue hemorrhagic shock, dangerous in the child. If not treated properly as well as cautiously, kid will die. I have lose one patient, only one patient till date. I lose one my dengue patients due to the acute liver failure within the 6 hours. due to the dengue virus. সকালে ভালো চা বিস্কুট খাচ্ছে 9 years old female patients who are admitted in the Mukherjee Medical College. Patients died within the 6 p.m. because of acute liver failure. We failed for that. Suddenly, his leakage is increased. And before that, all the enzymes of liver was right, but suddenly the dengue virus attacks the hepatitis cells, and that's acute liver failure and death. Anyway, that is maybe I lose a patient. Any one patient lose means 100% failure to me. Anyway, so this globulin, except the gamma globulin, all are synthesized in the liver. You'll oftenly asked questions in the Viva. Practically think, don't memorize at all. It is think and relate and coordinate with others. This is the physiology. This is the medicines. It is very much, very interesting if you understand that. So till these proteins, albumin and the globulin is there. Term extension is this alpha 1. Examples is alpha 1 antitrypsin. Alpha 1 antitrypsin. Alpha 2, example angiotensinogen. All are released from the release from liver. Beta globulin. কি যত রকমের clotting factors, coagulation factors. একটু আগে বলা হচ্ছিল না যে ব্লাডের মধ্যে প্লাজমা উইথ clotting factors. বোঝা যাচ্ছে? This beta type is present. So beta type means all the clotting factors are there. As well as these factors are present, transferrin protein is there. Just like if you want to read, and this gamma means antibody, and different types of gamma immunoglobulin are there. Kiki, মনে রাখিস maggot, MAGED. আমরা ভালো করে লিখে দিচ্ছি MAGAD. That means IgM, IgA, IgG, IgE, IgD. This is 1, 2, 3, 4, 5 types of gamma globulin are there. বোঝা যাচ্ছে? IgG, IgM, IgA, IgE, as well as IgE and D. All are specific. IgA for enterocytes, IgM for acute infections. Suppose a dengue je তোরা এতক্ষণ ধরে চলছি. What is a diagnostic test? Is a dengue IgM ELISA method. In case of IgG, that is আমার কোভিড হয়েছিল নাকি? আগে আমার কোভিড হয়েছিল নাকি 3-4 মাস আগে, তখন আমি কি করব? কোভিড ভাইরাসের আমি IgG দেখব. That means chronic infections. জন্য আমি দেখব IgG. কি বলো? Alpha 2 angiotensinogen. Angiotensinogen is a protein that is required for the blood vessel, blood pressure regulation system. It will come later. Just now remember that's alpha 2 angiotensinogen. Beta is all the coagulation factors, clotting factors, as well as transferrin. And gamma means IgG, IgM, IgM. These are all formed from the plasma cells. Plasma cells mean B cell. B cell means stem cell. Stem cell means bone marrow. That means red bone marrow is a site of synthesis of this one. So these things are about the proteins. Other protein also there. Fibrinogen. Fibrinogen is a key. Our say coagulation cascade. Fibrinogen is an inactive protein. It forms active protein fibrin to form the fibrin mesh for our bleeding stoppage. আমার এখানে কেটে গেল, আমার ব্লিডিংটা বন্ধ হবে কি করে? ফিব্রিন মেশওয়াক তৈরি করবে। কে তৈরি করবে? প্লাজমার মধ্যে কি আছে? ক্লটিং ফ্যাক্টরস আছে। Others থাকলো fibrinogen itself. প্রথম দিন also in the plasma. So in the plasma with the clotting factors. Remember that. In the serum without clotting factors are there. So these two differences between this serum and the plasma is there. So till now we have understood that there are three components mainly in the blood. One is plasma, that is 55%. One is red cells, RBC, that is hematocrit. It is essentially important for different diseases like the dengue fever. And also we keep the buffy coat, that is platelets and the leukocytes, right? Now in the plasma, mostly the water is present. This is watery, so that our blood is watery. And so the different proteins are there. that is most important protein and abundant protein is globulin, albumin. So this albumin is important to reduce the oncotic pressure or colloidal osmotic pressure to prevent the edema or pulls the blood that is done by this hydrostatic pressure. So these are balancing, na? These are balancing. আমার তো পায়ে edema নেই, তোর তো edema নেই। কিন্তু খানিকক্ষণ যদি তুই ট্রেনে মানে অনেকক্ষণ ধরে যাচ্ছিস, that is called dependent edema. That is a non-pathological, that is a physiological edema. It will stay comes in কিছু কিছু adult patientদের ক্ষেত্রে হয় এবং যারা obese তাদের ক্ষেত্রে হয়। Edema has different cause are there. One of the important cause due to related to the plasma and the albumin is like that. If it is less, then the fluid will be accumulated in here. Fluid এখানে accumulated হলেই তুই বাইরে থেকে দেখতে পাবি that edema. That may be pitting edema, non-pitting edema. But remember, in case of lack of albumin or in decrease in an albumin level, always hitting pitting edema. So already I told you the different causes of edema. So how can you differentiate clinically? যে হ্যাঁ এটা pitting edema তাহলে এটা albumin জন্য হতে পারে না, এটা non-pitting তাহলে এটা cardiogenic shock বা আমার কোনো একটা congestive cardiac failure জন্য হতে পারে। Congestive cardiac failure জন্য যে প্রোটিন আমাদের যে edema হয়, that is due to the congestions, liver failure, kidney failure, all are presented as a edema. But remember that clinics is not so easy. Whenever you are telling that edema means renal failure, not at all. If it is renal failure, first you have to swelling in the face. So face swelling is the first in case of renal cause, right? In case of cardiogenic cause or cardiological causes for the edema, then the lower part would be involved first. If it is any ascites or any tumor in the abdomen, then lower part will be firstly damaged, not sparing the upper part. But in renal cases, first facial puffiness, facial swelling, as well as whole body swelling and leg swelling will be there. So that is called edema. That is a huge things are there. Many diseases are there causing the edema. Is the pathological edema also there, physiological edema also there. In the pregnancy period, laster stage, that is also a mother can present with a pedal edema because of that heavy gravid uterus, right? So whenever you are pressure dealings, and that may cause the edema. Anyway, the albumin is a decreased oncotic pressure as well as colloidal oncotic pressure. If albumin is less, then the water will be deposited in the interstitial tissue, which is between the blood and the tissue. And then the globulin, there are different types of globulin are there, alpha 1, alpha 2, beta. These are formed in the liver, except the gamma globulin. It is 5 types: maggot, IgM, A, D, G, E, G. Different functions are there. IgE, like the allergic reactions, anaphylactic reactions, any types of worms infections, will be IgE level will be higher. Suppose you, some of you may be suffering from some chronic allergic reactions, and all her IgE level will be higher level because of these bronchial asthma patients, any allergic patients, skin rashes, IgE level will be high for the preventions. So anyway, these things are very much important in the later classes also. The globulin is a protein, and then different types of electrolytes. Already told you, sodium, potassium, calcium, magnesium, cations, anions, chloride, bicarbonates, all are important. And then also the hormones are present because of some, suppose, lipid friendly hormones like steroids, right? So that can be bound by the globulin part. বোঝা যাচ্ছে? গ্লোবুলিনে যে সমস্ত প্রোটিনরা আছে, that will may bind some hormones or elements or chemicals that can be bind by these binding factors are be there. So binding proteins may be present in the plasma to carry different types of hormones. Those are especially steroid hormones. Steroid hormone এমনি ঘুরে বেড়াবে না। They are lipid friendly. তারা water friendly নয়. If it is not water friendly, then you have to carry by some others. So that's carry others means some protein will be there for the carrier. That the globulin is very helpful. And any fibrinogen is present in the plasma, it acts as a fibrin clot formations. Prothrombin also a coagulation is a coagulation cascade, and so it is important to learn that plasma te amar eto kichu ache. So anything you are detected by this, আমি clotting factors test করতে যাইছি, কোন একটা clotting factor disease আছে, অনেক আছে, we will come later. So we will draw the blood centrifugations and then separate the plasma, and from plasma this test will be done. Any clotting factor deficiency is present or not, it is done by the plasma, not the RBC or the Buffy code. Buffy code is only for the platelets and key leukocytes. So this plasma, overall plasma, almost I am giving a gist, because plasma is a huge thing. It is not possible for us to cover up all the things of plasma, but these are the basic things. If you in this class up to till now, if you understood up to this, it will be very helpful for the practical class also. Anyway, so this come to the plasma, and now RBC. What do you mean by RBC? RBC is a huge class, will be there for one, how it is synthesis, what is the problems, what are the associated factors between these RBCs. Lack of RBCs are there. Lack of RBC means hematocrit value is less or may be presented as anemia, right? আমার যদি দেখা যায় একটা পেশেন্টের এইখানেতে 45% পেলাম, আর একটা পেশেন্টে দেখা গেল সেন্ট্রিফিউজ করে এখানে 35% পেলাম, আর একটা পেশেন্ট দিয়ে গেলাম এই 45টা হয়ে গেছে 55%. So what are the called is this? One is normal. If it is 55, that means hematocrit value is high. That means polycythemia. It is a term. And if it is 35%, that means less. It is called anemia. That may be different causes of anemia are there. Everything is important. Anemia is a huge thing. Anemia, if the department wants, so I will teach the anemia, how it is approached, how it is done. So in these cases, RBC functions is that to কি করবে? Transport the oxygen and also carbon dioxide. Main function is there. How? It's presence of hemoglobin, heme and globin. Heme is a part, is the iron is present. So any patient suffering from iron deficiency may cause in anemia. So different, in this way we can approach anemia. So learn about the hemoglobin structure, etc. Now day by day I will go through forward. The RBC is a red blood cells. Another name is erythrocyte. Cyte means cell. Erythro means red. যেমন leukocytes, leuko means white, cyte means cells. So this is leukocyte. Platelet is a cell. Platelet is a cell. তাহলে কি? Yes, very good. This is a fragmented RBC platelet, because the huge cell is a megakaryocyte, is formed from the hemocytoblast, or it is from the hemopoietic stem cell. Then it is fragmented and squeezed through the blood, right? In the RBC, we will go to the details about that in the next classes. That is, the hemoglobin is present, and hemoglobin among the iron is present, and each and every hemoglobin atom carries the 4 molecules of like a cab. তোর ক্যাব ভাড়া করিস না, ক্যাব ভাড়া করে 4 জন মিলে চাপলি, সেরকম 4টে অ্যাটমস অফ অক্সিজেন ক্যারি। কোথায় নিয়ে গেল? মনে কর এখান থেকে চাপলি স্টেশনে নিয়ে গেল, ও তাই করে। অক্সিজেন কোত্থেকে নেবে? লাংস থেকে নেবে। নিচ্ছি তো, কন্টিনিউয়াস অক্সিজেন নিচ্ছি, কার্বন ডাইঅক্সাইড ছাড়ছি তো, taking this way. Whenever you are in the alveolar regions, is the capillaries are there, exchange occurring, exchange between the oxygen, carbon dioxide, and due to the pressure changes are there. Due to the pressure changes are there, and due to the pressure changes, oxygen is coming in to provide the cells. Cell কেন অক্সিজেন দরকার? Cell কেন অক্সিজেন দরকার? That is called cellular respiration, because of formation of ATP, right? তাই তো আমার ATP দরকার, and that's why this RBC had 3 characters are there. One is circular, another is biconcave, another is it is non-nucleated. তার মানে নিউক্লিয়াস নেই। সার্কুলার, biconcave, কেন biconcave হয় হয়তো 12 এ পড়ে এসেছিস, you know why it is biconcave. Biconcave shape means what? Biconcave shape means this, like it is seen from the side. If it is from the উপর থেকে যদি দেখা যায়, তাহলে দেখা যাবে এই রকম, that is circular, and central pallor is there. And next size is এর থেকে বড় হচ্ছে আমাদের লিউকোসাইটস, রাইট? তার থেকেও ছোট, মানে এদের থেকে সবার থেকে ছোট হচ্ছে প্লেটলেটস। So anyway, this RBC chapter will be in the next class also. This is the biconcave. Biconcave is the flexibility will be high. It can cross the fenestrated capillaries, and so there is must be no damage will be there, right? Number 1. Number 2, this due to this biconcave shape, if it is poured in the hypotonic solution, it cannot be burst. কারণ কি it increases surface area. Why surface area is increased surface area is important? Because to carry the most of the oxygen. That's why surface area is important. So all are linked up. If it is not the biconcave and your body is supposedly any hypotonic, then the hemolysis will occur by the bursting of the RBC cells and hemolysis, and you will be suffering from this problem. And that may happens due to the structural problems of many diseases, like different types of hereditary spherocytosis. মানে কি তার biconvex সেফার নেই, this is spherocyte cells, right? I will come later. This is a very rare disease. I have came across till now 1%, and she or he may died basically within the 7 month of age. Okay, remember the name is the prince. That was name is Asansol, and diagnosed is kind of the chronic is a pallor is coming, daily pallor. Then I diagnosed the case. That is a hereditary spherocytosis. Only seeing one test in the CBC test diagnosis হয়েছে, and diagnosis কি হবে না RBC indices will come across in the next 2 to 3 classes, and also practical also তোদের হবে। RBC indices এর মধ্যে MCHC বলে একটা টেস্ট হয়, MCHC mean hemoglobin corpuscular concentrations, right? So this is a normal level is 33%, but these patients was 83%, and that was the diagnostic for the hereditary spherocytosis. And then genetics test also done by the parents, tried the different areas, but this failed to remove because the same problem. Spheroids biconcave নয়, তাহলে কি হচ্ছে বাস্টিং অফ আরবিসি হচ্ছে, আরবিসি ভেঙেই যাচ্ছে, তো তৈরি হচ্ছে। আরবিসি লাইফ স্প্যান কত 120 days। কোথায় গিয়ে হয় স্প্লিনিক ম্যাক্রোফেজেস or spleen or in the liver also, it causing the key this is a dying of 120 days lifespan of the RBC. So these things are important for you, and the whole thing, see the plasma is very important. Within the Buffy code, that is the leukocytes function. Next day class hobe ami jigesh korbo, it is your homa. Leukocytes functions, platelets functions, etc. It is your homa. Go through this, and so these leukocytes are nothing but a white blood cell that is important for the defense mechanism. আমার শরীরে কোন একটা ব্যাকটেরিয়া ঢুকে গেল, সে ছাড়বে না, সে he will detects the আমার foreign body কে আছে। Now WBC is different, is 5 types are there. One is agranulocytes, other is granulocytes. Granulocytes means Ben, BEN is a granulocyte. BEN, what does mean? Basophil, E for eosinophil, N for neutrophil, is a granulocyte. That means in cytoplasm is presence of granulocytes are there, and lymphocytes and monocytes are agranulocytes. No granules are there. It is your practical classes will be there. Anyway, these things are important. The veins to remember, and lymphocytes are also important for the defense mechanism. Remember always, neutrophil increase for acute infections, lymphocyte increase in case of chronic infections. So these things are important too in day by day practices also, and these sorts of neutrophils, basophils, etc. Within this, one important thing is the monocyte or the monocyte and lymphocyte. What is the monocyte and macrophages? Are these two same or the different? Because already your homework is a leukocyte functions. In the functions, you came across the macrophages. So what do you mean by macrophages and what do you mean by monocytes? Remember always, both things are same. In the blood, it is called monocyte. In the tissue, it is called macrophages. In the tissue, different types of macrophages in different name. Like in the liver, it is called Kupffer cell. In the brain, it is called microglial cell. In the in the bone, it is called osteoclast. So these things are the macrophages. So macrophages are in the tissue, monocytes in the blood. Remember that this is not the separate thing. This is absolutely same. Function is same. So monocytosis means presence of monocytes increase in the blood. Right? Time agache 1 minute. So 1 minute is there. So in these cases, all the things are you have to correlate. Correlation is very important. কেন এটা হচ্ছে? এইটা পড়লে ইউ কান্ট মেমোরাইজ, মেমোরি করতে হবে না। আজকের পড়া শুধু ভাব যে স্যার কি 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 পড়া বলে গেল। সেন্ট্রিফিউগেশনস নাম্বার 1, কম্পোনেন্টস, প্লাজমা 55%, 45%, হিমাটোক্রিট কেন লাগে অল্প অল্প করে বলে গেছি, অ্যালবুমিন, অঙ্কোটিক প্রেশার, গ্লোবিউলিন, ডিফারেন্ট টাইপস অ্যান্ড ফাংশন, ইলেকট্রোলাইটস, হরমোনস, হ্যাঁ, আরবিসি. So if I ask in your viva, I am very tough examiner. If I am proper particular, you will fail. যা কিছু ফেল হয় সব আমার হাত দিয়ে হয়। But if I always questions very easy and very best level. If I ask in your senior classes, I have asked the RBC এর মধ্যে কি আছে বলতে পারিনি, so he will definitely will fail. আমাদের স্যার আছেন তাই কিছুটা পাস করে দেন, বাট নেক্সট ইয়ার থেকে সেটা হবে না। ইউ আর লাকি, মোটামুটি হয়তো হয়ে যাবে, মেবি। বাট প্লিজ বিলিভ মি, ইন দ্য ভাইভা অলওয়েজ ইন দ্য বেসিক থিংস আর দেয়ার। সাপোজ আই এম আস্কিং ইউ ইন ইউর ফার্স্ট এক্সাম ফর দ্য ফাংশন অফ ব্লাড, কি বলবি? 4টে ফাংশন বল, 4টে ফাংশন বলে ছুটি আজকে। টেল মি দ্য ফাংশন অফ ব্লাড। মুখ কিন্তু খুলতে হবে, এর মধ্যেই আমি বলে গেছি। ফাংশন অফ ব্লাড বল। ট্রান্সপোর্টেশন, তাহলে আগেই আমি করে দিই, লিখে দিই একটা ট্রান্সপোর্ট হয়ে গেছে বাবু, হয়ে গেছে ট্রান্সপোর্ট। তাহলে ফার্স্ট ফাংশন হচ্ছে টি, ট্রান্সপোর্ট। নাম্বার 2 ডিফেন্স লিউকোসাইটস বলেছি, তাহলে ডি, ডিফেন্স। নাম্বার 3 ক্লটিং ফ্যাক্টরস আছে যাতে ব্লাড লস না হয়, দ্যাট ইজ কল হিমোস্ট্যাসিস, হিমোস্ট্যাসিস। স্ট্যাসিস মিন্স বন্ধ, স্ট্যাসিস মানে বন্ধ, কি? ব্লাড। নাম্বার 4 ইলেকট্রোলাইটস এর ব্যালেন্স, হরমোনাল ব্যালেন্স, ইলেকট্রোলাইটস এর ডিফারেন্ট সোডিয়াম পটাশিয়ামের ব্যালেন্স, মানে কি ইন্টারনাল এনভায়রনমেন্টের কন্ডিশনকে প্রিজার্ভ করা, তাকে কি বলা হয়? হোমিওস্ট্যাসিস। দ্যাট ইজ কল্ড হোমিওস্ট্যাসিস, both are different, hemostasis and homeostasis. These 4 function, if you tell in front of any examiner, this will be clear. So transport, defense, hemostasis, homeostasis. Finish. Thank you very much. It's been my class. Thank you.